the homeless services system policy team. And so I've been here about 2 weeks as of tomorrow. Nice to meet y'all.
Hi, everyone. Sorry, bad connection over here. Leah Knapp, she, her pronouns. I'm on the OHCS government relations team. I get to work with our fabulous housing stabilization folks, so rental assistance, housing stability supports, homeless services, and energy services. So I know lots of you, and we'll be supporting the work to kind of pull together a policy after you release your recommendations. And then just a general point person. I know there are lots of legislative experts and advocates in the space too, so always here to support. Thanks.
Thanks, Leanne and Amanda. And I think that's all the OHCS staffers on the call tonight, but I'll just add to the folks that are assigned as kind of those key people. Many of them are really there to be able to kind of pull in additional support. So, as you're diving into subcommittee structures and talking about the questions that are coming up, we want to be available to pull in additional folks that are really those program experts. Maybe you want to talk about a specific program or dive into specific nuance. That's really kind of how we see our role here, is to bring in those program experts as you need it. So if you're able to, even ahead of time say, hey, I know I really want to dig into this specific conversation or this program, or talk about this problem, reach out to me, reach out to Mary Francis, to Nikan. We're happy to try to coordinate getting those folks at your subcommittee meetings to make sure that we're prepared, able to answer your questions, and have the right folks in the room to do that. I'd also add to like a good example of this, the topic of insurance came up at one of the subcommittee meetings. I think it was this week. And that's actually a lot of that work. A lot of those policies live with another state agency, with a Department of Administrative Services. So if those types of conversations are coming up and you want us to try to pull in another state agency or another conversation, we're happy to also try to coordinate doing that too. So, see us as a resource, try to answer your questions, and also as partners to try to brainstorm if you want to get into more depth and more detail. I know also some of the subcommittees have really relied on, trying to bring in that expertise from ICF. I also want to acknowledge that part of ICF's role as like a neutral facilitator is super helpful. They also bring a whole host of depth and expertise in actually doing this work and providing technical assistance across the country that I want to make sure that the subcommittee can tap into as you all see fit too. So I definitely want to make sure that we're leaning into that role as well, because they bring a wealth of expertise too.
Mike, as I mentioned earlier, I'm actually going to kick it back to Mike. We did want to make sure that everyone had access to the same information here in this setting. So for some of you, this is going to be repetitive or a little bit redundant. I would ask that you hang tight, because we really want to create some space this evening to dialogue around what you've heard and surface some of the both the concerns that you might have, but also the highlights of what you've heard, and some things that we might really want to keep in the system, things that have been functioning well or working effectively, or really supporting the work that we're trying to move forward here. So Mike, I'm going to ask you to do a high-level overview of the current state of affairs and how funding is structured for the benefit of the full task force.
Absolutely, thank you so much. And yeah, I will try to be efficient with my words here, so that we can get into any questions or discussions that the whole task force may have. So I've got a very kind of light single page PowerPoint that I'm going to share here. And I actually did add one slide to it at the recommendation of Ashley Hamilton, kind of talking a little bit more about some of the things that community action agencies do after they receive funding. So just try to make sure that we're getting a full picture here. So this is just a sort of a very high level slide that tries to get at some of the processes that we take in order to actually get resources that are allocated from the legislature out to the state through a formula process. that goes to the community action agencies. So this is our current process for many of the funding that we receive through current service level funds. Current service level funding is money that's generally appropriated to a state agency every biennium. So this does not apply to some of the emergency funds that we've allocated this year, some of the resources that we've gotten and deployed for shelter and eviction prevention and other pieces of that work. So really honing in on this community action agency process, I thought it made sense to kind of talk about that. If you'd like to know more about sort of how we deployed other resources this year, I'm happy to talk more about that as well. But just sort of as a high level, this is how the process works, so you all get a sense for it. So, really looking at the legislature allocating resources to Oregon Housing Community Services, as well as federal allocations from partners at the Housing and Urban Development, Health and Human Services, and other federal agencies that allocate resources to OHCS. So OHCS receives resources from one of these places, legislature or the federal agency. And then we utilize data to create a formula that really divides up the resources across 18 different community action agencies. There's 18 different community action agencies. 17 of them are geographically located, so they cover a county area, maybe multiple county areas, and some of our more rural parts of the state. And then there is one community action agency that covers the entire geographic spread of the state, but they focus on farm workers. That's the Oregon Human Development Corporation, OHDC. They receive a portion of the funding that is really driven by data around farm workers in Oregon, and then the rest of the resources are deployed throughout that geographic formula. The formula looks at things like the point in time count, so how many people are experiencing homelessness in a particular region. It looks at things like the housing burden of in a specific area. It looks at data about the number of people experiencing poverty, and we can actually use different factors and weight those different factors depending on the specific program that we're allocating. So a good example of this is if we're looking at deploying a veterans program, we can look at veteran-specific program data to understand how to allocate those resources. There's a lot of kind of different nuance that I can pull in additional kind of experts in if folks want to dig in more about the specific formulas. But essentially, we're taking a certain set of resources that we get from one of these sources and divvying it up throughout the state by a formula that is somewhat allows us to ensure that community action agencies and their respective communities have a sense for how much they're going to be receiving every year, every biennium. After we go from the formula process, we're issuing out those formulas, sharing them with community action agencies for that upcoming fiscal year, and really trying to make sure that we're breaking it out by program so they can really plan and design their systems. So we're going kind of from here. Community action agencies have that information. Then we create what's called an implementation report. Implementation reports are essentially where we get details from the community action agencies about the specific tasks that they'll be doing for those fund sources. A lot of our grants allow for a variety of uses. You may be able to do street outreach or shelter or provide homelessness prevention resources and really go broad on a lot of different interventions. So the implementation report is really where we get the budget and we get the specific details about what that community is going to be doing. We understand more about their subrecipients and who they're going to be working with in their community, and just overall get a better sense of their strategies. This is also where we look at things like what their policies and procedures are and make sure that they have all of the different policies and procedures that they're required to have for our different fund sources. So this is really where we're going back and forth, having a lot of interaction between program staff and community action agencies that really are able to kind of dig into some of this information. From here, we go into the master grant agreement process. This is actually the legal document that we enter into agreements between Oregon Housing Community Services and the community action agencies. The master grant agreement is a single grant agreement with these entities that have multiple different programs embedded within it. So sometimes up to 20 different program elements where we're able to deliver a whole range of different services to community action agencies. So ranging from energy and weatherization services to community services block grant programs, emergency solutions grant, all the different types of programs that we deploy, we're actually able to put them in one agreement and deploy them all together. And that really does help improve some efficiencies for us to be able to get all of these resources out to community action agencies in a relatively short period of time. It's not always perfect. There's processes that take, every biennium, I think we've used a different system for collecting implementation reports. And that does cause, a lot of learning for our partners on the ground to really understand, what we're expecting and the process for how they're supposed to go through it. This agreement gets sent out to community action agencies. They're signing those agreements and then really providing the implementation reports once they're approved back. And essentially, we're in business at this point. So we're loading budgets into our financial systems, getting master grant agreements signed, and then moving forward from there to actually allow the community action agencies to start spending and to start providing those services. They're entering into subrecipient agreements, providing the services in their geographic area, and really just starting to deploy the different programs that they have. At this point, we're providing technical assistance, we're providing oversight. Questions might come up from a grantee like, can I spend money on this thing? Is this an eligible expenditure? I ran into this problem with a client. Can you help me understand what I should do here? And we're really having back and forth about different issues that might be arising as they deliver the services. At this point, too, I think it's important to know, and this is kind of where Ashley pointed out earlier, is that community action agencies are also required to abide by certain policies like a spend down policy. It's something we've implemented in the last few years to help understand the trend of how folks are actually spending down those resources. So if they have say $1 million grant, we ask them to provide milestones along the way for them to actually spend down those resources in a timely manner. And that helps to avoid getting to the end of a period like a fiscal year or a biennium and not having spent any of the resources. It allows us to be able to reallocate resources to a different region. For instance, if one region isn't able to spend it or isn't able to use all those funds, we could redeploy it to a different region. They're also entering in homeless management information systems data. So that's our HMIS reporting. So they're actually inputting the services that they provided and really going through and making sure that we're understanding sort of the outcomes and the actual work that they're doing with clients. So there's a lot of more nuance and detail I'm sure that I'm missing in this high level overview, but this is essentially the process. Every 2 years, this process takes place. Basically, we're starting at the beginning here, at the beginning of the 2-year period. And then we're just moving forward from here to get those master grant agreements out, and then services are being delivered. So that's really the cadence for us, and has been, more or less for the last many years as we've worked with the community action agencies. Again, this doesn't apply for our emergency programming that goes to non-community action agencies. It is really just sort of an overview of our process for CAAs. So hopefully that's helpful. I don't see the chat right now, so I'm going to stop sharing my screen and would love to see if there's any questions or comments on all that. Thank you, Ashley, for that. Yeah, budget change request is the BCRs. It's another process that happens there. So if you have a plan for your budget and you need to change your budget because you get additional funding or you didn't spend as much money in one category, community action agencies can submit a change request where they can actually move money from one category to another. So that's just a good example of kind of some of the business processes that they're having to take on too. Any questions? Yeah, sorry.
Yeah, I was just going to say that, Mike. I know many of you have had an opportunity to already have heard and processed and sat with this information, but if there aren't any questions, I would love to hear the range of perspectives and how you see the current state's funding structure, maybe just to generate some dialogue amongst task force members, because March will be here in no time, and we do want to be able to move away from the discovery phase about current processes and really refer back to the recommendations that you all submitted, so that we can figure out how to prioritize specific recommendations that will be actionable for consideration by the Legislative Assembly. So love to hear from members. Jennifer?
Yeah, I can chime in. So we had a really interesting conversation. I don't know, was it last week, week before, whenever it was? Because what is time at this point? About how the current funding structure seems to be leaving out a segment of organizations that are doing critical work, but have to rely on their relationships to community action agencies to get some form of funding. And often that funding is the invoiced back, like it's reimbursements. And so thinking through making a recommendation where some money is set aside, where it's flexible money in, sorry, my dogs are being annoying, flexible money in that organizations that aren't already in the flow of the funding structure have an opportunity to essentially compete or bring forth their best ideas of how they're solving the crises in their community and would have access to a level of funding. And part of that funding would be, or at least in addition to part of that funding would be capacity building to get them to the qualifications they need or that are required to be a community action agency or whatever we want to call them moving forward, so that the current number of them expands and is truly reflective of the work that's being done and the communities that are being served.
Oh, no, that's your Alan.
Yeah, I'll just piggyback off that a little bit. One of the conversations that we had in our committee is there's agencies out there like Helping Hands that we serve multiple counties, multiple agencies, multiple communities that have no access to the SHAP or the EHA dollars now. And historically, when we did it, that money never reached the service. It kind of got sucked up in admin and data entry and stuff like that. So there's not competitiveness outside of the CAAs, the community action agencies, because the way the funding structure is right now is it all gets funneled through community action. And so, and I give you an example, about 7 years ago, we were offered $12,000 in SHAP money. But we had to feed the HMIS system. That year I spent $18,000 on data entry to receive $12,000, and not a penny of that money ever went to the service. And then when we attempted to get reimbursed for the data entry, we were told that we could not get reimbursed for the data entry. We had to use it on an electric bill or a gas bill and water bills. Only one of the counties that we serve are we capable of applying. We don't get it in Yamhill County, Lincoln County, Multnomah County, or access to that at all. And it's an important pot of money for the services that we provide. So that's kind of been one of the reasons that I'm really involved in this, is because there's great agencies out there providing wonderful services that don't get access to apply.
Thank you, Alan. I think we have Paula next.
So I got to make sure I get my little guy down. I agree with everything that Alan said, that it is very difficult to do the great work that many agencies outside of the Community Action Network does. But I really think now is a perfect time for Jill and Mike to describe the nuances and the requirements that come with SHAP, that come with EHA. And we too, as a community action agency who does receive SHAP and does receive EHA, we spend an astronomical amount of money on data. I've been doing this work. I've worked at CAPCO for 31 years, and the tide has done a total tandem. The tandem has swung, and we now spend more than 50% on basically data collection, whether it's the intake worker, the street outreach, the case manager collecting data versus really helping and personalizing case plans and so forth. So I agree that there isn't much room for competition the way the system works right now, but I would love to have what you described, the flexibility and not have to spend so much time on data. But I don't know if we will ever have that kind of freedom to do that. So that's not a community action issue. That's an Oregon Housing and Community Services. In my area specifically, if I didn't have to spend thousands and thousands and thousands of dollars on data, I would be in a better position to either enhance our services or bring on more like organizations doing similar work and pass those funds through. But the data is astronomical.
Thank you, Paula, for sharing that, because I don't know if I agree it's astronomical, but data is definitely a requirement for any funding you receive from a government entity. As long as we're spending tax dollars, we have these requirements imposed upon us to be able to report on, measure, and describe how we're using the funding, and hopefully be able to measure our outcomes and look across the system at what's working and what's not, and then speak to our legislative body about why we're succeeding or not, and how we would like to have them invest more funding. I have run programs for decades, Paula, and I know it's a substantial amount of work, and it is necessary and required when you receive this funding. And I have to tell you, if anything, requirements will increase rather than decrease. As we really try to invest in ending homelessness and understand what works.
And I just wanted to make sure, because I've heard Alan and others kind of talk about, everything that has to be done. And we have to do that. And I feel your pain. And I do think it's astronomical in comparison to direct client services. And we're only talking about EHA and SHAP and, how that fits into HMIS. But to be a community action agency, we also have to abide by the organizational standards for the Community Services Block Grant. And that's where it draws out that community action agencies have to have a local community needs assessment, how often it has to be done, what our board structure is. That's where it specifically identifies that we cannot compensate board members for their contribution and for the work. And so in that organizational standards, there's all kinds of additional requirements that we have that the federal government has imposed on us. And I apologize, but for some reason I cannot take down my hand. So I don't know if Mary Frances, if you can do it for me, but I'm hitting it and it won't go away. Perfect. Thank you.
I'm just I don't see anyone with their hand up just yet. So I do want to kind of reaffirm the sentiments that data collection isn't going away, certainly from a federal perspective, and that is across homelessness specific funding, but also that CSBG, CDBG funding. I've been a recipient before, and the reporting for CSBG and CDBG are close enough, but slightly different to where the data collection is certainly a challenge. And I think that from my lens and working, you know, directly with the state in different capacities, there is some work that's being done to improve some of the reporting efficiencies. And that will definitely take time. Also at the federal level, some of the work that folks on our team do with HUD at least, around like those HMIS data and technical standards, which are revised every 2 years. There's a lot of work being done to make the systems easier so that it reduces the burden on the end users that are responsible for inputting the information, at least into HMIS. So I just wanted to weigh in with that. What else is coming up for folks? Oh, Jessica.
Hey there, I just wanted to reinforce and add to what Jennifer said. She and I were the work group last week, and for a potential recommendation for a set aside for what we sort of described as an innovation, infrastructure building pot of money, to really beef up the capacity on the ground of people who can do the equity work that we're actually here, supposed to be focusing on in this task force. I'm currently at the Association of Oregon Counties annual conference, and we had 4 of the 8 House Bill 4123 pilots present this morning. And one of the interesting things they mentioned was, I think it's Tillamook County, actually paid all or most of its partners at the community level to come to the table. It was like $5,000. It was, not a lot of money, but it incented them to come. Maybe for some of the smaller agencies, it actually did allow, a warm body to leave the office and be there. But if we decide as a task force that we want to move that particular recommendation forward, I would just throw out there some flexibility for the organizations or individuals who would be applying for those innovations to maybe have some money to incent local partners to enter into a mentorship relationship with them to really capitalize on the expertise in the community, to start building those relationships, to really help grow that needed missing capacity for the equity work.
Thank you for that, Jessica. How about other folks in the room? And not bypassing the fact that it sounds like there's a recommendation that's surfacing that folks on the task force might need to consider. I don't know if you want to hear recommendations as they surface and vote on them, if you want to see something in writing and have an opportunity to sit with it and then vote on it, but do want to name that it sounds like Jennifer suggested a recommendation and Jessica reaffirmed that.
From my standpoint, I don't think I would be comfortable in making any kind of a decision without having a conversation and input and having it on the agenda and something in writing ahead of time.
I agree. It'd be nice to have sort of an idea board where, all the work group recommendations are represented in one place, and then we can really dig into and fill people in on the missing pieces who weren't involved in the conversations on a given item.
And there may even be overlap that that there could be comments or recommendations that could be under one recommendation. We can combine several, perhaps.
I'd also like to put a recommendation on the table. Sorry for the noise in the background. I'm trying to make dinner for the kiddos, but I'd also like to make a recommendation, just thinking about Jill's point of data and admin requirements not going away and actually becoming more cumbersome, probably, especially in the field of homelessness, that whatever those are, that OHCS and other state agencies, this might be a recommendation for Ways and Means, but sort of dovetail into funding the administrative capacity that's necessary to do that work. Because a lot of it, isn't necessarily lack of familiarity or lack of willingness to do the work. We just don't have the bodies to do it. And so having some dollars, knowing what the requirements are going to be ahead of time, and then having dollars to be able to meet them is really important. Yes, it is more money and it's astronomical to everyone's point, but the public is not going to not have data. That's just not something that we can expect.
I would just add on to that. Is there a way to account for that work as a separate service element, or really call it out so that our funders understand the burden of it and the scope, the quantity of work, the bodies that are required, so that it's not an afterthought or some uncalculated cost of doing business, but is called out as really, I mean, data is an asset, right? It's value added to the system. So I think maybe it just needs to be more prominent in our discussions and our funding decisions, and not an unfunded thing that's sucking away service provision.
Or underfunded, because the typical amount is what, 5% admin rate or something?
But it's not admin, right? It's actually part of this.
I agree. Yeah, I hear you calling it out as a separate service area is what you're saying, instead of it being characterized as admin.
Yeah, because it's not admin. It's a vital part of the work that's being done.
I would support that amendment. What I recommended.
And we're tracking. So we're tracking all these good recommendations. Alan and then Jennifer.
Yeah, Mike, is the data lake piece at the state level that Hunter was working on? Is that coming to? So one of the things for us, I mean, we kind of stepped out of the HMIS piece because it wasn't truly usable data for the way that we were running our service. That we were able to put in case management and these other pieces that were in addition to it. So we have our own system, but we collect data points in a certain manner that can be fed into the data lake at a state level. And the data we use is utilized for our case managers and some other pieces. So, Mike, is that getting close to completion? Are you aware of that?
Yeah, great question, Alan. So the data lake work right now is we're actually it's live, so we are able to do that in 4 of the 8 continuums of care across Oregon. The next step that we're working on now is this concept of data governance. So like, how do we as a state think about like all the data and all the data sharing between the different continuums of care? The way for others to kind of get context on this, homeless management information systems are developed and ran at the local level by continuums of care. There's 8 continuums of care in Oregon, and we have 3 different implementations of HMIS. OHCS is the manager of one of those implementations, but Lane County and the metro area, Multnomah, Washington, and Clackamas, have a separate, two separate HMIS implementations. So they don't talk to each other in a sense.
Right.
And so that the data governance conversation and the ability to get statewide data, that requires us to enter into agreements with those other HMIS implementations to share data and agree on quality data standards and sort of all of the different components of that. So that is the next, I'd say the next year's work. We've actually contracted with Portland State University to host that data work to actually help to bring all of those important conversations together to really start to go from there. I see Jill has her hand up too, and would love to see if she has any additional context or info on that.
Yeah, and I think the point I was getting to is that we collect the data with all the same points as HMIS does. We utilize it that way, and right now we've been working on ways to be able to share that data in this lake with a CRV file to figure out how to process that. And that helps a lot because we're not doing anything out of the ordinary. All of the funds that come in actually go directly to the service, and we can still collect that data in a way that's beneficial to our system that we utilize internally.
I don't want to jump the line, Jennifer, but I'll just quickly make a quick comment that we are still probably at least a year out, like Mike said, from getting to the point where we have the data governance piece wrapped up in a good solid understanding of how to move forward with that. I totally agree with and would love to see on our list Katrina's comment. I think that data is something that is of great value, and we need to value it just like we do a program. The value is that it allows us to tell a story that then results in greater investment in the program. So we need to pay for it, and we need to call it out separately and not just have it be embedded in a program. So that would be something that I think we should have part of our recommendation be focused on, because it is a really big deal right now.
I would second that.
And I would just echo it and take it a step further to say it's even more important when you're centering Black and Brown communities to have accurate data. And that, you know, if we are going to engage in, for me, what I believe to be anti-racist work as this task force and what we're tasked to do, then we need to have data that helps us and informs us to do this work and informs the state how to budget their resources accordingly. And it's an accountability tool. So if they don't do it, that becomes a problem. Because to me, that says you are not centering communities, or you're not taking seriously how communities that look like me are being affected by your current policies. And that allows for advocacy in new ways. It allows for us to have conversations with legislators in ways that we previously wouldn't be able to if we didn't have that data.
Thank you, Jennifer. Marisa?
Yeah, actually, I feel like what I'm saying is very strongly going to echo what Jennifer just said, but yeah, I was thinking along the same lines, like, you know, the data can really tell a success story, but it can also tell us where we need to improve. And I know that last year we kind of used the term iteration a lot, which I think is like something that is really useful and important to bring into this conversation about like the long-term growth of our programs, and just kind of always seeing it as the opportunity to you know, find areas that might need change or might need, you know, not necessarily more growth, but less growth. So yeah, I think that accountability piece can be really complex, and we don't have the data to look at, then we can't necessarily make those improvements.
Just going through some of the comments in the chat, a lot centered around data collections. Ashley, Nicole, Paula, do you want to speak to any of your comments in the chat?
No, I just wanted to I guess, be clear that I am not anti-data. Data, we have to have data, but we, as a community action agency, not just tie it into an HMIS, but we have to report to, through the Community Services Block Grant. We also have to do some direct reporting, and all of those things we are supposed to be able to, any other program that we have in our organization, because we receive CSBG, must also be tracked. So as an example, my agency does Area Agency on Aging. Has nothing to do with Oregon Housing and Community Services, but because we receive at least $1 of CSBG, we have to report all of that data through OHCS. And those systems don't talk to each other. And so therefore, what we are doing is we're working with 2, 3, and in some cases 4 different data systems that we're trying to get the information merged. And when I look at our final reports that we provide to OHCS, it is not telling the real stories. And I don't know how to make it all work. It's too complicated of a process and too complicated of a system for us to easily identify gaps in services. We know which communities and which neighborhoods and so forth are more marginalized, but we can't always show that easily with our data when we have to import so much data from different sources.
And to piggyback on that, I really feel like it would be a great recommendation to find a way to enable the data collection. We don't want to burden community agencies that are already doing the boots on the ground work with all that. That doesn't seem fair at all. If there's any way to help them with that, that would be great. And that way the community agencies could give us more context to that data, because the numbers, I mean, somebody can just go in and put numbers in, but then the agencies can give context to it, like Paula was just saying. I think that's really important, because if we don't know what that data is in context to, then it's not as helpful.
Thank you, Nicole. And Ashley surfaced a question around CAA HMIS data being shown to the group. The simple answer is no, but the longer answer is that for the discovery team last year around this time, we actually pulled HMIS data from every single COC in the state. So all 8 COCs, we pulled the data, we did an analysis, and that analysis is included in the report on findings and recommendation. There's also on the back end things that didn't go into the report, or some specific questions that each of the 8 EOCs, based on their data profile, could use to probe whether or not they were experiencing different disparities based on specific project components, like transitional housing versus emergency shelter versus rapid rehousing versus permanent supportive housing. Of those findings, the one consistent feature across all 8 COCs within the state was that it was, and I don't want to misquote the report here, but essentially there was a disproportionate share of folks who identified as white being able to access permanent supportive housing across all 8 COCs. The other data analyses really were specific and needed to be contextualized locally through some probing questions to really kind of scratch the surface. Yes, I can see that. And the COC's use of HMIS shouldn't be different than a CAA. HUD requires specific data and technical standards. There's a very prescriptive data collection process. So as it responds to people experiencing homelessness, like a COC should have their own individual governance structure that tells providers, whether you're a community action agency, whether you're a CSO, a CBO, or a faith-based partner that elects to opt in and use HMIS, how to enter the data, how to collect the data. And yes, that is also true. There are a number of agencies that don't participate in HMIS. I want to say this though, because I see that we are getting very heavy into the data conversation. There was a report that we referenced earlier this year that did an analysis of, you know, maybe 30 COCs, which is a drop in the bucket. But in that report, and this report is called Moving Beyond the Equity Plateau. It talked about how data can paralyze communities from moving forward in matters of racial equity, because there often comes a debate about data quality or how perfect or imperfect the data is. I'm here to tell you from a national landscape, Oregon is not unique. Y'all have disparities. They're clearly defined in the report on findings and recommendations, and those findings are consistent with virtually every community throughout this country. So yes, we should absolutely be focusing on data, and we should also draw the conversation back to changing the state's funding structure, modifying the contracting processes, looking at eligibility and coming up with solutions for that, because we will forever be looking to reach for the stars when it comes to perfect data, and that just doesn't exist. The homeless response system in this country actually has the more advanced data collection methods and collection systems when you look at other sectors. So Jessica, you have your hand up.
Forgive me if this is in the report and I've just forgotten it, but I'm just curious, in particular, the finding of disproportionate accessing of permanent supportive housing. Did we ever dig deeper into understanding why that was?
We didn't. That was just part of it is we had 7 weeks, and there was a lot to pack in that report, but also to be unpacked. I could speculate on why that is, and it has a lot to do with the ways in which HUD has given guidance to communities on prioritization through coordinated entry. And I want to stay away from all of the technical stuff and not kind of nerd out on all of those HUD federal regulations and requirements. But the ways in which communities have been forced to prioritize across scarce resources really has resulted in certain features being used to prioritize, which kind of tip the scale towards predominantly white, predominantly single adult male for permanent supportive housing. And that is something I can say HUD is working on addressing.
Okay.
We've been working with communities, but that is like, again, you all are not unique. This is not just an Oregon specific problem. This is that systemic piece. This is policies being well-intentioned, but being set at the federal government side, who is a bit far removed from what's happening on the ground and in communities, and forcing us to have to really put people in a priority listing based on vulnerability. I'll use age as a criteria. If you look at the aging population will automatically slant towards white individuals just because they have a longer lifespan for a number of reasons. So if you are prioritizing based on age, you've already got a little bit of bias baked in there. And I'll use Anchorage, Alaska as an example. We did some work up there this past spring to help demobilize some of their large shelters after COVID was kind of winding down, but surfacing back up. And what we found by changing their prioritization criteria to align with how Alaska Natives identified as elder, which was the 55-year-old threshold instead of 65, we started to see more prioritization of Alaska Natives because they were in that 55 to 65 range with a disabling condition. So when you are forced because of resource scarcity to have to ration out the resources, you're going to have in your process some implicit or explicit biases that impact who receives the services versus who doesn't.
And so is there any flexibility at the state level about that prioritization, or is it a completely federal mandate. Okay, I don't want to waste time on things that we can't control.
No. So what Ashley just put in the chat is spot on. That is a conversation that has to be had at a COC level. So COCs are continuums of care. These are your interconnected networks of service providers, local government, police department, hospital, discharge planners, you name it, community members. And they have the autonomy within the regulations to establish a prioritization criteria and a process. I also want to name that many communities, when HUD first published these recommendations, interpreted the guidance as needing to develop an assessment tool versus an assessment process. And most communities pulled an off-the-shelf tool, which is known as the VI-SPDAT, or the Vulnerability Index Service Prioritization Decision Assistance Tool, what we call it the VI-SPDAT for short. And that had some inherent biases on it. It was tested in an area that predominantly featured white, single, older, disabled men. So you have this tool. For many communities, it helped them with their coordinated entry process, but there was a study done on the tool and on the results, and there was a lot of bias baked into that system, that assessment tool. And the result was some people were prioritized basically because of certain features, and some folks were not prioritized because of certain features, and that had a disparate impact on particularly Black and Brown folks.
So has that report been sort of translated or condensed and communicated to COCs in a way that is helpful to them to identify the things in their community that are creating unintentional disparities? Or is that just an awesome report that no one has actually seen on the ground?
If I can just jump in there, keep in mind that many of the CFCs are part of the Community Action Agency network. So like CAPCO, we're a community action agency and we're the lead on the CFC.
That still doesn't
So
answer the
have
question, though.
Oregon COCs been exposed to that?
Yes.
And and you're able to interpret it and use it to
Well,
make
I'm
changes.
not sure
To
if I can-
assess your current criteria and make any needed changes.
Well, we look at OHCS as being the driver of that. Maybe that's incorrect.
So it's
And the
not
C-
done locally.
No.
No.
So when it comes to coordinated entry, and Ashley listed some of the core elements, that is a function of the COC. And actually the collaborative applicant would be the one to step into the leadership posture around convening stakeholders to surface any experience immunity or any process deficiencies around coordinated entry. I should also note that at least for one, maybe more of the community action agencies, they might be in a dual role where they are serving as both the collaborative applicant and also the HMIS lead. So they're the ones that are responsible for enforcing the data standards collection across the different COC partners. Oh, Jill, you've got a hand up.
I just wanted to point out something that was kind of an aha to me when I came to work for the state a year ago. I've always worked administering federally funded programs and worked closely with the COCs my whole career, and didn't realize that the state, that OHCS, until very recently really isn't connected to the COCs, which is the main homeless funding distribution system in the country. So that was a big aha for me. And so this year we have intentionally done a few things to start making that connection and invest in them and their work, because they really know their communities as the CAA network does. So that was an aha that I wanted to share.
Thank you, Jill. And I think my colleague Mike Thomas is on the line. Mike, you have experience with the balance of state in Georgia, which covers, I don't know how many counties, but could you just share a little bit about your experience working with, you know, the equivalent agency in the state of Georgia to OHCS and how you all work to facilitate greater collaboration in the state?
Yeah, I can share a little about that. So we did work collaboratively with all the COCs in the state, and most of that work in our case happened through HMIS governance of all things, because we had an HMIS implementation that was in almost every single COC in the state. And so that was the place where all of the COC representatives were in, one place at one time. And we had the state was also the HMIS lead, or the governance lead over the HMIS governance system. So that's the venue through which we did it. That's what popped into my mind because I was thinking about the data lake that we talked about earlier. But, in general, it was just having representatives from each COC in the same place at the same time that was beneficial. And it doesn't have to happen through HMIS governance. There's other venues for that. But it really helped us move things in positive directions. Like there were always questions about people crossing COC borders and, which COC are they going to be served in and which funding source and all that stuff. So that's how we did it in Georgia. We just were fortunate to have that sort of ready-made venue with HMIS governance. But there's numerous other ways you can create a venue like that. And that was really beneficial for us.
Thanks, Mike. And thanks for dropping those links in there. Jessica, I think it was you that asked earlier about the data and the reports, and the link is dropped in there. You can actually see the disparities. Full disclaimer, we did use point in time as a metric to kind of look across race, ethnicity, but also sheltered versus unsheltered, single adults versus families as a part of this analysis. And there are call out boxes for the groups that are experiencing a disproportionate representation in homelessness in comparison to their share of the general population. I think that starts on maybe page 14 or 15. See the conversation slowing down a little bit, and I do want to inquire of the task force a couple of things. First, for our subcommittee meetings that we are in the process of getting on the books, but also for our next task force meeting, which is right in the midst of many, many different religious and or cultural holidays. We are scheduled to meet on December 20th. I believe that's the day. Would love to hear from the task force if that is a time that you all say, no, we don't want to meet. We want to come back strong in January. Those of you who are troopers last Hanukkah / Christmas / Kwanzaa / everything in between. Remember. Okay.
I'll be off work, so I'm available.
Okay. I'm down. Listen, I am down to hang.
I will speak to like not wanting to meet right before the holidays and to come back in January, just because I can feel that end of year malaise starting to sink in. I'm just like, I can't, don't ask me any questions or to make decisions.
It would be tough for me too, only because of the holidays.
Teresa, Ariel, Maria, Jill, what are y'all thinking? Jessica?
I say wait till January.
Okay, January, flexible either way. Okay, well, that doesn't, subcommittees still have to move forward and meet though. So the other question that I had is, as you are engaging in your subcommittee, thank you for that, Ashley. Are there any subject matter experts that you would like to come and be on hand? Whether, I think we had a request for DAS to come. Mike, was it DAS? Which was like great, innovative, out of the box thinking. But if you all, yes, thank you, Katrina. If you all can let us know who you'd like to attend the meeting outside of your staffing support from both ICF and also OHCS, we do want to make sure that we've got the right people in the room to answer the questions at the right times. And you don't have to answer that right now, but definitely send like a bat signal in the sky to the East Coast if you're like, I found the subject matter expert that I want to come to the subcommittee meeting. Any closing thoughts from anyone? It's been a great dialogue this evening.
At the national level, is there a state that's been in the same situation that's figured it out that we could, or at least have gotten close to figuring it out, that we could have come talk to us?
Yes. State of Virginia. That is a state that has gone through a pretty transformational process. I actually text Mike during the meeting to say, hey, like if y'all need a thought partner, state of Virginia has developed their data lake, can connect you with the person who's responsible for that, and they can share materials. But the state of Virginia is one in which there is both a dense urban sort of city center in Northern Virginia, and then very, very, very rural, multiple county balance of state COCs, and then you've got like some pockets of density in Richmond and Portsmouth and Norfolk, but interesting geography, not as geographically large as the state of Oregon, but the same exact issues and challenges. And I think the state of Virginia, I watched their evolution. I watched them grow into their leadership posture and really harness coordination, collaboration, and really leaned into the federal strategic plan as a way to kind of align their policies, their priorities, but also the funding to make sure that they were as competitive as possible as a state to do things like being the first state to end veteran homelessness, to have a really significant decrease in homelessness over a longitudinal period, and to be able to sustain that, to pivot to address the evictions crisis when Virginia was on the naughty list for evictions, particularly for Black and Brown communities, and mobilizing a task force and investing resources and innovation. So I would hands down recommend the state of Virginia. That's my old stomping ground, so I know a lot of peeps there, and actually a good colleague, former colleague, has just transitioned over to the U.S. Interagency Council on Homelessness as one of their senior regional advisors, and has decades of experience and helped lead that transformation. So at any point in time, happy to bring in the state of Virginia, but also other state leaders. It doesn't just have to be one. I mean, I think there are best practices that can be learned and shared from many states, including you all. I know we're here to talk about systemic change, but y'all have a lot of really, really bright spots happening throughout the state all the time. So I share y'all with other communities too. I'm like, look what Oregon's doing. Y'all need to do this.
I can't get my hand to go up, but is it fair to say that other states have different funding systems because like, doesn't Washington allocate a lot of their money to the counties, and then the counties have that kind of local control? So I think we should take that into consideration as well as we look at, all of these funding opportunities. Is, does the whole system need to be dumped out and started over? Because I don't know if Washington is looked at as a golden child, but their entire funding runs much differently than Oregon's. Am I correct on that, Mike? Or Jill? Don't they work much differently? It's a whole different system.
It is, I would say it is a lot more focused on the sort of accountability from counties. Like one difference is that they require 5-year strategic plans from every county that's participating in their system. So there's like a lot more, I would say, kind of that back and forth. So yeah, that's a good point. I know we've talked in some of the subcommittees as well about like the role of local government in responding to homelessness, and really trying to make sure that we're thinking about sort of our other local government partners, whether cities or counties, as kind of another piece of this puzzle too.
And isn't there, Jessica, I know you said you were at AOC, and isn't there a push with some along with League of Oregon Cities, kind of a push from the county and city level to address homelessness through a congressional or a legislative ask of money?
I'll let Ariel answer that particular question. I would just say from the county's perspective, the pilots are doing really well. People are very excited about them. Some great connections are being made on the ground. So I feel great about where it's going. I mean, it remains to be seen, right? How they turn out in the end, but it's been a really great process so far. So I think there's some potential there.
All of the various requests, and we'll work on lining that up. Probably going to say that we'll go ahead and remove the December 20th meeting. I feel like I heard more nays than yays, and what better gift than the gift of spending time with your family or doing something other than your volunteer assignment here on the task force. But we will, of course, remain in tight communication through the subcommittee structure, and you can reach any member of the team by email, set up a meeting if you want to chat or talk or have a suggestion. We are also going to set up a recommendations repository. Nitan is going to work on that so that as things surface, you all can have a link to a Google form, and we can kind of keep a running track so that we can make sure that folks have an opportunity to see and sit with and process and digest things as they come up before we bring a matter to vote. Barring that, I would say happy Wednesday to each of you, and I'm sure I'll be seeing you in the subcommittee meetings.
Thank you, Mary Frances.
Thanks, y'all. Have a great evening.
Thank you.
Thank you. Good night, guys.